So a lot of people ask me how we do benefits in a cash-based practice. So I'm going to give you an example and find out what I found out new regarding health insurance. So currently we have a 3PT practice with a front desk, okay? And we run the strategy of what I've done is I've actually put everything through a health share, and then we also subscribe to a concierge physician. So I view it as the health share is the major medical coverage. It's going to protect major medical anything, surgeries, hospitalizations, et cetera, stuff like that. All the small stuff is going to run through the concierge physician with imaging, any kind of ins and outs, physician visits, physicals, et cetera, stuff like that. So I kind of covered both of us on that one. And then the PTs get an APTA membership and they get $1,000 of Con Ed. So this is an example, and we'll go over exactly how much benefits cost and how we do things running it through a health share. Okay, so PT1 and family, this is the owner probably. This is me in this case, but this is probably the owner and their family. For the family plan for the health share, it's this plus the concierge uh, physician membership, then the APTA funds and the Con Ed. This is $873 a month. Okay. As you start adding on staff, you're going to have some sort of benefits also. So PT2, everything's going to vary based on age, pre-existing conditions, whether their spouse has health insurance, et cetera. So for PT2, health shares this. It's just a um, single person. That's for the health share. It costs this much to have a concierge physician for a monthly membership. Again, these are just every month I pay this for the the company pays this every month. A PTA membership plus $83 a month on Con Ed. We give $1,000 a year for Con Ed, and it costs us this a month. PT3, she has healthcare benefits through her husband, so she doesn't need this, but she does like joining the concierge practice. She's a member here for this. Same thing again, 228 a month. Front desk, we offer again health share plus the concierge membership. So it's $235 a month. So the total month, every month we pay this amount, $1,705 for um, benefits a month in a cash-based practice with three PTs and a front desk. Now, the health share is great. There's pros and cons regarding health shares and stuff like that. If I would say these are some of the common options, Samaritan Ministries I've heard is the best one here. I've had some patients really like it too, and they reimburse well and they make it super simple and easy. Zion HealthShare would probably be next. I've heard they're really easier to work with. They may or may not cover everything. In the past, we've had Liberty HealthShare and MediShare. For major medical coverage, I thought it was good. We never needed it for that, but for all the little ins and outs things, they wouldn't apply anything to my AUA or what they call the deductible. They wouldn't cover any of it or even apply any of my stuff towards a deductible. So again, I'm not using it for day-to-day stuff, but when I have healthcare expenses, they wouldn't even apply it towards. So I dropped them pretty quick. So they're out there, they're options. You have to look and see which one is best for you and your family and your staff. But if I had to rank them from what I hear from experiences and what patients say, I would rank them Samaritan first, Zion HealthShare next, MediShare, and then Liberty HealthShare last. And there's other ones out there too. You can do your research. This is a great option to start out with just to make sure that you're covered with major medical, and then you can subscribe to a concierge physician for everything else. I liked it. That's what we've done for years. And it's worked, and everything worked out good so far regarding that. Patients, not patients, the staff really do like having the concierge physician on staff, so that's really helpful too. But again, my strategy here was to make sure everyone's covered for major medical, plus all the little ins and outs in the most cost-effective manner. Now, I recently came across this small business health insurance policy that I've been looking for this for years. Okay. So it's under United Healthcare, but I found this plan that supposedly you have no deductible. This is a health insurance policy for small business owners. And they have a group, and it has healthcare, major medical, dental, and vision also included in it. The health share stuff doesn't really call it, and they have certain guidelines regarding what they cover and what they don't. Again, I just use the health share for major medical coverage, the concierge physician for everything else, and I pay cash for everything. Now, with this one, the health insurance says no deductible and no co-insurance, and everything is pretty much covered. If you had to go to the hospital, I believe your max out of pocket would be like 3,000. Again, this is going to be different for you and your family and you and your staff, depending on pre-existing conditions and stuff like that. So these are examples of the health insurance policies that we got quoted here based off of our input and our quotes that we gave them with pre-existing conditions. So PT1 and family, $1,134 a month. Again, the concierge physician the same. Everything else is the same. PT2, $318 a month. Great option if you're a solopreneur with no family. $318 a month to have full coverage. That's a no-brainer on that one. That's pretty good there. $84 for concierge physician. Again, everything else is the same. PT3 still has health insurance through her husband. Front desk is $393. Again, this is including dental plans and vision plans. You can see that with this new plan, using a health insurance plan through this, I'll just call it the small business owner health insurance plan, you can see that everything has gone up $1,000 a month pretty much. But this is great news, by the way. And I've had multiple conversations with James. His name really is James Bond. I think that's pretty awesome. But I've had multiple conversations with James. He's the rep that you need to contact if you are interested in this plan. Just tell him that Ron sent you, and he'll make sure that you're taken care of. His contact information is right here. I've had multiple conversations with him. I was like, listen, this sounds like the perfect health insurance plan. What's the catch? I was like, I hate health insurance, period. But I was like, listen, what's the catch here? I was like, how is this possible? How am I just now hearing about this? And he's like, honestly, this is a plan that's just built for business owners. And we do exclude people who have severe pre-existing conditions and medical stuff. So this is pretty much an entrepreneur insurance plan for healthy people. And that's why things aren't crazy expensive, and they're able to cover everything. Now, based off, I mean, everyone's quotes are going to be different based off of what you want, your policy that you choose, your pre-existing conditions and stuff like that. But definitely something to look into if you're interested, especially if you have a family also. If you're a solopreneur, you can go the old route I did with the health share / the concierge physician. But for those who need full coverage health insurance, this is a great option to look into. The small business owner health insurance plan that I'll put all the links of everything in James's info below. If you have any questions for me, just shoot me a comment below also. But if you need to get in touch with him, his name's James Bond, thebondhealthgroup.com, and here's his cell phone number, and I'll put it in the description below. But this is how I run my health insurance, my benefits for Pursuit, and all the staff.